Hi there, and welcome again here at Smart Education in our venue in Leuven, the Novotel. My name is Stan. I'm co-founder at Smart Education, and I'm very happy to welcome our next guest, also for this interview, Lizzie Marlow. She's flying in from the UK, and she is our guest speaker here today on the course on the masterclass on running rehab. But what is more interesting and more important maybe is that she'll be coming back in June this year for her own course, a one-day course, which is called the Sporting Foot and Ankle. Lizzie, what can I tell about you? You're a specialist in musculoskeletal physiotherapy. You have a specific interest in lower limb injuries and also running injuries. That means that you're seeing patients every day?
Yes, yeah, I'm entirely clinical, so I see lots of patients every day. I mostly see lower limb patients, as you said. I see a lot of second opinion patients, so patients who've perhaps failed physio elsewhere. And because my special interest is in the foot and ankle, I think that lends quite well to running, and I see quite a lot of patients who have overuse running injuries as well.
Yeah. Well, you're a perfect guest then for the course that we're planning in June, which we still have 4 or 5 spots available. What kind of topics will be on the course? What will you talk about?
So I'm keen to break down the foot and ankle into key sections, and I really like to focus on a systematic approach to each section. So we'll be covering lateral ankle pain and lateral ankle injuries, so some traumatic and some non-traumatic injuries, and then we'll cover medial ankle pain, posterior ankle pain and plantar heel pain. And I really want to go over some of the pattern recognition skills, the key clinical features for each foot and ankle condition, and then some of the specific clinical tests to rule in or out those musculoskeletal conditions.
Okay, so that means that colleagues who are seeing, let's say, recreational competitive athletes in their own practice with foot and ankle conditions, what will they take home from this course? What will change in their daily practice after this course?
So for me, it's all about clinical reasoning and having a really specific, systematic approach to assessing the ankle, understanding the anatomy, the pathophysiology and the biomechanics, and how that relates to the patient in front of you, and then how you can use that knowledge to select specific tests to stress specific structures, and then come to an appropriate specific clinical diagnosis. And then I really want to have a practical emphasis on both the handling of the tests, but also the manual therapy and the rehab as well, and how that can be progressed.
Yeah, I think also footwear modification, stuff like that.
Yes, we'll definitely be covering footwear because I think that's really, really important in the foot and ankle, but also in sporting populations, especially in the runner. So I'm going to have lots of case studies throughout, and we're going to discuss how each case can be managed with regards to footwear and all the different modifications.
Sounds great. I'm in. If you want to join us on the 2nd of June here in Leuven, do visit our website and maybe you can grab some of the last spots available. Hope to see you then. Hope to see you again. Of course, we will see each other. See you then. Bye.